to Caribbean House Talk. At Caribbean House Talk, we always aim to bring you the issues that are funny, the issues that are curious, and even tearfully serious. On today's Caribbean House Talk, we have quite a show lined up for you. As always, we try to do a balanced show, and we are in the business of edutainment, meaning we educate while entertain. Edutain. All right, so ladies, are you ready to roll?
Yeah, we're ready to roll.
Yeah.
In fact, why don't we get started right now with the spicy dish?
Ooh.
Okay, so how about, Trish, you do the honors first.
Oh dear. Okay, the spicy dish. Oh boy. And this, as you guys know, is where we put things in a dish and somebody pick it out and we discuss it. Can you live in a sexless marriage? Yeah. Can you live in a sexless
At my
marriage?
age, yes, I can.
No, I can't.
I can. I can.
You can't.
You can?
You've had enough.
No big
I'm
deal.
not there yet. I can't.
This one makes no words.
I can.
No.
So, Miss Caroline, can you live in a
I
sexless
don't,
marriage?
I don't know. I mean, it depends on what happens, circumstances.
Mhm.
It could be a situation where, if your spouse has, an illness or whatever, and you may not have a choice. I think if you have a choice, of course you want to have the sex, but if you have no choice, then I guess so, because your whole thing is to grow in companionship, and when you're married for a long time, other things take precedence more than the sex,
You have a friendship, you have a camaraderie. You
exactly.
Have
But of course, you want the sex. That's it.
Well, on the note that you just bring up, that little
Yeah.
clip in there. If your husband is sick, fine. Yeah, I get that. But I wasn't thinking that he's sick. And
Yeah,
that,
right.
You go with the flow.
Right.
I go with the flow, but my husband is fine. So, no.
Bring it.
Bring it on.
I said before in a previous show, I may be old, but I ain't cold.
Exactly.
However,
All right.
However, I would say this, that I do take away a little bit of what each of you said. You're in a long-term relationship, or at least a relationship where you've already bonded with this person, and there's an illness. You're not going to leave the guy
Okay, no.
because he can't perform.
Oh.
But for me to pick up a man who have that issue from scratch, from the
Right.
jump,
Oh,
Right.
yeah.
unless I'm good and
Yeah.
old, like
Yeah.
really old,
Yeah.
hell no.
Mm-hmm.
I'm not doing it. But if I'm with someone, we develop a friendship, we have that camaraderie, that trust,
Right.
we have a lot going for us, we know each other. He comes down with something, and we're going to talk about prostate cancer later on in this show, with something like that, and it renders him incompetent. That's the time where me as a wife, as a girlfriend, it's going to kick in and say, you know what, babe, it doesn't matter. We'll find alternative ways. It's all good. Make him feel good about himself and find other ways to be excited, to get excitement, and not just focus on that. But here's really why I would not go in from the start at this age with someone who has that problem. It doesn't matter if I mind. Men are very insecure about their ability to function sexually, and some of it is because of this society, the pressure they put on them.
Yeah.
Everything hinges on how much he can perform, what size he got, and what. So when you have a situation like that, the poor guy, even though you might really not care, he has a problem. He's thinking, oh my God, I can't even perform for my girl or my wife. So he may have a problem, and that brings a certain amount of tension into the relationship.
Issues are gonna manifest into other parts of your relationship. Yeah.
So I definitely am thinking that I will not be comfortable with starting one, but if I'm in one where we already have the sex and we already know
Yeah.
each other, I don't
Yeah,
see that being a
that's-
deal breaker
makes a
for me.
difference.
But I won't start one, honey.
What about if you start a relationship with someone and like months into the relationship he get diagnosed with prostate cancer? What would you do at that point?
You know what? A lot can happen in months.
Mm-hmm.
You can get really to know somebody in months. And I really feel that once there's some bonding there, maybe there's not a long history, but there's some bonding there, and you get to know this guy. He's been taking you out. He's been like rubbing your feet when you're tired. He's been that person you can call at night and chat with, because
Right.
you're not going to leave the guy because of that. I'm saying for me to meet you, and I know that. I don't think so, because I know the insecurity.
Yeah,
Because
but-
hopefully by that time we probably have already done the done.
But if it's
Yeah,
months,
done
it's
to do.
6
Yeah.
months. I mean, you might kind of want to be around as a friend to help. I don't know if you really want to be like
As
that,
somebody who is
that
being-
girlfriend, because you know it's still a young relationship, and you still want to be sexually aroused.
Mm-hmm.
I mean, do you want to just have your?
I'm not gonna lie, it's not gonna be
Like,
easy, because like when you say months, if you say 6 months, I really don't know this person that long. We haven't had a whole life together. But I'm still saying, let's say for instance, I'll give you an idea. Let's say this is someone that I've known for a long time. We've had a great friendship, and now we took it somewhere to the romantic level. And right after that, he found out. That's the thing I'm talking about, where I'm not necessarily saying this is a deal breaker. We may not have been romantic for long, but maybe we have a long friendship staring back, however. And that may be a situation where I might say, okay, you know, this is my great friend. We at least have that friendship. We've gone through the you know, it still won't be easy, because again, you don't have that long history. You guys are people who are with your spouses or your partners for a long time. If that pops into the picture, you're so vested in making sure this person is okay, you know, that you're not worried about, you know,
But I hear you ladies talking about prostate. Prostate, depending, the little I know about prostate cancer, depending on what you
the
type
procedure
of
that was used.
procedure that's used, but it doesn't really inhibit sexual contact. Not in all men. It just depends on what.
Yeah,
You know,
What type of
so-
surgery they had?
Yeah,
What type of
because
procedure?
I know men who say they're fine,
Okay.
but it depends on the type of.
Okay, we're going to talk about that later
Right.
on in our their help team section.
Yeah, but you know, just getting back to the question, Trish. Okay, so in your case, and in most of us here, we're mature women, you know. But I think a 30-something, someone who's 35,
Even 40
whatever,
something.
yeah.
Right, that's
If you're
different.
with somebody for 6 months, you won't just cut them off. But I don't think I would want to have that person as my boyfriend and never have sex. You know, I mean, that just.
Yeah, someone asked me that question. She found
be
herself in that
friends.
position, and she asked me, what do I do? And I said, to be honest with you, if it's me, I will balance. Like, I have to be a friend, but, you know,
Exactly.
but at the same time, she wants to cut everything off, and she wants to know if that's the right thing to do. And nobody could tell you what's the right thing to do, and you find yourself in situations like that. But, you know,
But what
go
about
with
the
the flow, go with how you
servicemen?
feel.
What about the servicemen? They go to war, whatever. They get these
Yeah.
injuries. They can't do anything. They're young men, and they have young wives at home. What about them? Have you ever thought about these women? And I've seen them a lot on TV, where the woman is pushing him in a wheelchair. You know, certain parts cut off and this and that. I often think,
A
well,
dildo?
what is going on?
But they're also young lives too. If you're just dating someone,
Yeah,
it
that's what I'm
becomes a
saying,
little
you know,
bit more
it's-
difficult to say, "Am I
it's
going
hard.
to give up my entire sexual life?" And we've been. in
But
a
people can have
relationship for a
sex
few
without
months.
actual intercourse, so we need you to not get our head just wrapped around that.
I'm gonna tell you
A
something.
lot of it too depends.
My
Wait, wait, wait.
daughter, if one of my daughters who are young had a situation like that, I'd have to have them really think, do you want to give up? You know, sex when you're very young is extremely important.
Important.
That,
But you
that's
can still have
important.
it, but it's just not the.
And there is no just not when you're 25, 30, you know, this, let me just play around with my finger. I don't think that kind of works.
The other stuff, honey. Don't be
You know,
limited.
yeah, but I'm just saying it's a lot different.
I think there's more joy with sexual intercourse.
It's more
Yeah,
personal. It's more
exactly.
intimate.
So
you know?
you
It's
wanna
more
you're
intimate,
young,
it's
It's
you
not
more
wanna
mechanical.
have it.
Yeah, not mechanical.
Yeah, but
I didn't say it was going to be easy, but you know, there are cases where, like you said, I think it's an age thing. You're older, you're probably not not even that into it that much anymore. And if you are, you'll probably, if you guys been with your husbands for a long period of time, you are not going to be, that wouldn't be a deal breaker. But it is a rough one when you're talking about, and I definitely would not start a relationship with that. If it's a new relationship, that's still going to be difficult because you're telling me now, okay, I've had you for 6 months. We might have done the do, but just as I'm getting ready to get used to you, you have this issue, and I know you're going to be jealous and insecure because you can't.
Whatever the issue is,
Yeah.
it doesn't have to be prostrating. Whatever issue that prevents you from
Premature ejaculations,
having,
what have you.
Sex.
And then goes the pressure that men feel when they have these issues, because we do put a lot of emphasis on that.
Yeah, they feel
Yeah.
like they're less of a man. I've heard the older men, men 50 up talking about,
Hell, that's my age.
but they talk about it.
Mhm.
Because I have a lot of male friends and much younger than I am, and they talk about it,
Mhm.
Well, so they go through it too, they go through a personal thing,
And sometimes they
What if I'm
sabotage relationships
Yeah.
because they can't give you what you want, and they sabotage and get you to leave. I've seen that.
Yeah.
Okay, well, all right, let's move on to the next
Okay.
question. Irma, right next to me, you get the next one.
Okay, let me see what's in this dish that is so spicy today. The spiciness of it all. Is it ladylike to wear pants to bed?
A woman to wear pants to bed, like pajama pants. That may sound weird.
It sounds weird to me. I don't care. I wear whatever I want.
You're an old married woman.
You're never a young married woman. I still wore what
Not
I
old
want.
meaning in age, but you've been married for a long time, so you probably could wear a sock and he won't care.
No, he cared because even when I was younger, what he didn't like I used to have scrubs. With the shirt and the pants. I used to wear them. He hated that. He really.
Why you
He
wear
wanted
scrubs?
to burn them. I don't know. Somebody gave me scrubs, but they were just so comfortable.
Then he got
And
to fight to get that off. But suppose he just have easy access.
You know what? I'm gonna tell you something. And I don't reveal too much personal, but one of the issues I've always had was when it comes to what women wear to bed. Does it really matter? It comes off anyway. So I'm like, man says, okay, you need to wear something really sexy. Wear this. What the hell does it matter? It's gonna come right off. I don't think it should matter. And I personally, I have to be comfortable. I don't like to be cold, and I like my pants on my shorts.
I like to be pretty going to my bed. That is always my lifestyle. Just go buy the real hot lingerie. But now as I grow older, and in Jamaica I probably would go wear that lingerie. But now it's cold. I have to go to bed in my pajamas.
So it's a seasonal thing for you.
For me, it's seasonal. I have to have my pajamas.
What do you wear to
They're
bed?
not sexy.
I
They
do.
have
Do you wear-
sexy
do you wear
like
pajama pants?
pants,
I
pajama
know,
pants,
satin pajamas.
and
I
nice
don't
tops.
like wearing pajama pants. I never really loved pajamas.
Not
I
with Mr.
never-
3 times
no.
a week.
No, even before that, I rather wear like a
Something
teddy,
nicer there.
yeah, something just throw over like a little short dress or something, like a nightie as they call
I'm
it.
going to be honest and say,
But I don't do pajamas. I never did.
don't do pajamas.
Mm-mm.
I would be honest and say pajamas would come in when I'm well seasoned in a relationship, not earlier on.
Yeah.
You know what I
I
mean?
don't like it.
And seasonal. If it's cold, of course, I just want to put some socks and some pajamas on. But if I'm in a relationship, no, I want the sexy nightie. But this came up. This was interesting. I think you were there. We were having lunch with a friend, and he brought that up. Like he hated it. Like, I don't like a woman wearing pajama pants, to bed. I just feel like it's not
He
sexy.
wants easy access.
Yes.
He doesn't want to feel like there are two men in the bed, I guess.
That could happen too.
That,
He wants easy access.
That's it. He don't want him to put any walk to that. He don't want the prelude to be a lot of walk. He wants it to be easy access.
I love my silk and satin pajamas. I just go for them.
Ooh.
But that's me.
Okay. All right. So our next topic.
Here's our next topic.
Pass it down, Lady
Here
H.
we go.
Means I gotta put my glasses on.
Mhm.
Okay. Would you ever marry someone you never had sex with? Please. No.
Please.
I can't see why. No.
No,
No?
no, no.
They didn't even hesitate.
You know
Like,
what
no.
you gotta know what you're getting into before you get there.
Mhm.
Yeah.
Yeah, I mean, Lord, suppose after the
Let's say
wedding.
like when you were married, when you were young, and nobody our age, next year some fanatical Christian or something, not just fanatical. If you're a Christian person, maybe you'll have religious reasons why you don't. I think when you're younger, you might tend to be thinking along those lines. But I don't think women our age are going to be doing that. I can say for me,
Yeah, I don't think so.
there is no way in hell. I mean, I answer this way. Would you buy a shoe and wait till you get home to try it on?
No.
Well, in Jamaica, we say.
So, you, with a guy, be safe, use precaution, but why the hell you want to take him home as a husband? And if, I could quickly see the lady, because what is there in terms of, because you may be covering a whole host of sins there, the issue we discussed earlier. So, yeah.
In Jamaica, you said what?
You didn't want puss in a bag.
You didn't want pussy in the back. What does that mean?
Don't want what?
Puss in a bag.
Puss in
In a bag?
a puss in a bag.
Puss, not
Oh, sorry.
I used to wonder what it meant, but then I realized that's what they mean.
What do they
want
mean? I don't get
something,
it.
a cat in a bag. They want to know what they're getting into.
Mm.
I
You want to buy the shoes, test it, make sure it fits,
right,
check
you
it out.
know, I now hear that all the time. Jamaicans are the
Ooh. Yeah, I definitely, I think there is such a thing as not being quick. I think some women sell themselves short. I think the minute that they date a guy, they get pressured into having relations with that guy. You're not looking at me with that bull crap. I'm a very conservative person with certain things. But I do think I would want to try the shoes and then decide if it fits well, take it home.
Mm-hmm.
In other words, I would want to know before I go marry you or really put you or anything like that. But and it kind of overlaps a little bit of what we said earlier, in that if a person has issues, don't you want to know that?
Mm-hmm.
Next thing I know, on my wedding night or when you're ready to move in with me, I can't function. I don't think I want to do that.
Okay.
Don't want to do that.
Keep it
I didn't hear that from Caroline.
I mean, listen, I say whatever works for you. There are people who will do it, and I mean young women who believe that, no sex before marriage. I respect you either way. If you want it, if you want to wait, you don't want to wait, that's up to you. I mean, I personally, I never said that to my daughters, but my thing is, I do think you should try stuff out first. I wouldn't want to get stuck in a marriage with somebody who's
functional.
can't function or make me happy.
Mm-hmm.
There's a show called The Bachelor. I don't know if you ever watched it. Anybody
Oh, that
watch
bit,
it?
yeah.
Yeah,
Okay.
watch it a couple
Well,
times.
there's this guy on, and he's an NFL player, I think, and he's a virgin. He's 30 odd years old, and he's a virgin.
Oh, I saw that prelude
And
and I think
I
Wendy
tell you,
Williams. Yeah.
That America is up in arms about that because the guy is a virgin, and he says, "I don't want to run around with I want to one woman." So now he's in January. The show is going to come back on, and he's going to be showing finding a woman, and most of the women, a lot of the women says, "I want someone who is experienced." He says, "I'm going to stay true to myself, and I'm a virgin." And
I remember this. I saw a clip and one girl walked out on him.
one girl because of that.
She was like, I'm
He
not
was
dealing with that.
Actually, he was not picked because of that. It was very interesting to me, so I watched it. So in January, I want to see who he gets and who will, the show will start again.
Because there's some
He is
virgins out there.
Why would a virgin want to be with
Yeah,
a virgin? Like
that's
nobody
the
know.
thing, because
I don't
they-
want to have to
they
tell you
teach
where to
each
put it.
other.
But,
They teach
but
each
some
other.
people
No.
may not. He
I
may
don't
not
want to.
necessarily get a version at 30 something. He may not get another one like him. But there will be
I
women
don't know
willing to
if he's
teach.
looking for a virgin, but
Yeah,
he
He
himself
is one. He
is
didn't say
saving
he's looking
himself
for one.
for that. You know, so
And that's okay. It's okay
I'm
if
very
that's what he
curious.
wants.
It's
you
okay.
know.
Well, if he's open to being with an experienced woman, then that may not be a problem. But if they're both virgins, how do you know where to put anything? I mean,
Of course,
you know.
You read
You
You
know.
find out,
know.
you learn to
It's
discover
signs, you know.
each other.
You will
Yeah.
know,
You just
and
choose
they
not
will
to get
learn
involved.
something about each other. I think, you know, you have to put your mind there.
Okay, let's say
And
that.
maybe it's not so bad because you tell them what you like and how you like it and the way you like it.
And they learn together.
Yeah,
Exactly.
I support that.
And
I
that's
really
even
do.
with someone who's experienced. You gotta tell a man what you like. He may just want to hit it and bam, bam, bam. And you want to tell him, slow it down. I like it this way. I like it that way. So anyone you're with, you're gonna learn how each other's body flows. So.
Oh yeah.
You get it?
I can't imagine that because let's go back to another topic we talked about on a previous show. Teeny tiny. The size matter. What if that's what he's covering? And let's say you're a size queen. I'm not a size queen, but let's say you're a woman some women are size queens. They like a size, you know. So you're covering this stuff, and you say, you know what? Hear me out, Caroline. You're covering this up because you're saying, if I only show them how teeny tiny I am, she's probably not going to date me. So I'm going to marry her, and then she'll probably feel stuck, and she'll probably hopefully stick around, and I'm a nice guy, so she'll probably get to like me. What if that's what he is? I mean, is he willing to reveal certain things at least? I don't know that.
Trish, let me say something on that. Because somebody says they're a virgin, it does not mean that they don't do other things. They consider themselves a virgin because of non-penetration. It doesn't mean that the person doesn't want to be touched or rubbed or I don't want to get explicit, but oral sex, it doesn't mean that they don't participate in other things. They consider a virgin not penetrating. Okay?
Right. Yeah.
They don't necessarily consider oral sex.
Well, for me,
So that means that it doesn't mean the person is hiding what they are, because they could be doing a whole lot of other things, just not penetrating.
oh Lord, okay. But you know what? For me,
You're right.
you may not, for me to do that, I would have. Oh Lord, let me not go there. I'm a grandma. I gotta be decent. But I would have to see if it functions. Not necessarily with that, but if it functions, and I would have to know what instrument I'm dealing with. Like, is it puny? Is it average? Is it? I'm not a size queen. I'm just saying.
Well, just
Anyway.
blow it up. That's
Whew,
all.
okay, let me not.
It's an individual thing, I would imagine.
Yeah.
You know, and we all have our own, you know, way of looking at life and experiencing life. So, Trish, we won't knock you.
I mean, men don't get turned off by women who are virgins, so why should a woman be turned off? if the
But
man
less
is
is
one?
required of the woman. A woman
And so
just
you
like
teach
it,
and you learn, and like
Right.
I said,
a man needs to have certain things happen for that to be successful. Therein lies the difference.
I don't.
Oh my
I
gosh!
think it's
All
just
right,
a matter of preference.
we are going to take a break, and when we come back, we are going to go into their health team section, which has to do, I believe we're covering something on prostate cancer. So we will be right back. Visit Elias Restaurant, a unique Greek Caribbean fusion restaurant where the food is heavenly, the service divine, and the ambience mesmerizing. Enjoy bakes and saltfish, roti, jerk chicken, curry chicken, stew fish, oxtail, curry goat, stew turkey, pea soup, comfort soup, sour beer, ginger beer, Slovaki dinners, clubhouse sandwiches, and so much more. Visit Elias Restaurant, located at 3310 Q Street in Toronto, Canada. You are watching QX-TV, Cultural Experience Television. We will be right back. Okay, welcome back to Caribbean House Talk. And on the House Talk today, one of the topics we're going to be talking about is prostate cancer. And I'm going to just go through it in a very general way. We will hope to have somebody who's more of an expert who counsels men with this issue and could probably shed some more light on it in a later show. But I'm going to just talk about it in a general way. Prostate cancer is cancer that begins in tissues of the prostate glands. Women don't have a prostate. Okay, we have other cancers and other issues, but prostates we don't have. Located just below the bladder and in front of the rectum. The prostate is the male sex gland responsible for the production of semen. Okay? Every case, I just learned something right there. I didn't know that was responsible for that. Every case of prostate cancer is different. The disease may behave differently from one patient to another. By age 50, about half of all men experience small changes in the size and shape of the cells in the prostate as part of the typical aging process. So you can have changes without necessarily it being that you have the big C. Understanding whether those changes are signs of disease and knowing your risk for developing prostate cancer are the first steps in protecting your health. Fortunately, prostate cancer is one of the most treatable malignancies if it is caught early. Routine screening has improved the diagnosis of prostate cancer in recent years. In addition, evidence-based therapies may help to minimize the side effect of prostate treatment, including incontinence and erectile dysfunction. The Cancer Expert at Cancer Treatment Centers of America have extensive experience in staging and diagnosing the disease and developing a treatment plan tailored to your specific type and stage of prostate cancer. So again, nothing we're reading here regarding health is for. This is not even advice. This is just we just give you some basic stuff. And again, we're gonna have someone in at a later show that would hopefully be able to shed some light on this issue of prostate cancer and what people go through in the therapies and so forth. But this is a real issue with older men that affecting older men, and it bothers on something that we were talking about earlier with, can you live in a sexless marriage? Would you date somebody without having, because especially if you're dating around my age, and I'm not one that's going to date men, really young men. You might be a few years younger than me, but you're not going to be men that are crazy younger than me. I'm not embarrassing my kids having some man who's their age, and that's just me. So each his own. I would have to have somebody within the vicinity of my age. And the reality of that is that a male my age and older is very likely to have these kind of problems. So that's why we're saying earlier, it depends on what age you start you're dating this person, whether you started before this issue comes up or came up, and then what happens there. It causes incontinence and it causes some people erectile dysfunction. And it makes men sometimes a lot hesitant to approach a woman who they feel might be looking for that and they're not able to. And you might be passing over a very nice person who just have this problem.
Right.
Does anybody want to share anything, any knowledge, you have any experience with this? It might be that a friend, a colleague, what have you. I haven't had anyone close to me with that issue.
Yeah.
So I never had a close-up. But I know, like from a distance, I know people who've had the surgery, not necessarily people I'm close to. But it's kind of a tricky kind of situation. You don't really want to, be.
I have a very close friend. He had a pretty young man too, and he found out in a very bad way. He talks about it and he cries. And he had
a young man?
Probably about 55. And he went to the best, and he had what you call it, some seeds implanted.
Oh, okay. Yeah,
right?
That, yeah.
So, and he sort of brings me up to date on what's happening in that area, and he says because of that, he can do his thing, do anything.
So he's still sexually
active.
Yeah,
he's sexually active, but there are certain things that he has to do before he gets to that point.
It's not spontaneous, but he can get
right. So and he tells me some people have cuts out the cancer because if there's cancer, some of them have surgeries, or there are different things. I think about 6 different things that you can do to treat, prostate.
Yeah.
And I mean, it's not a friendly thing. Anybody can have it. From this, the doctor says 45 years old, you can start having that.
I mean, younger than that, I know somebody younger than that.
Yeah, so, it's something that men really go through. Some of them, some men I know, are afraid to go to the doctor to check.
And that's crazy.
That's crazy.
I did a
You need to
fair
go.
when I ran the Chamber of Commerce. I decided to do a health fair, and I did a health fair, and I got all these doctors and nurses, to come in and give their point of view. And the doctor, the doctor who came, he said, "Well, bring all the men you know, invite them. It's going to be free, And those men, I think we had 30 men there, and out of that 30 men, only 20 wanted to go take the examination. And it was just a preliminary examination, but he said at that point you could tell whether something is going on. And the others, they just wouldn't, because they're afraid or ashamed or whatever.
And it's crazy because it is one of the most treatable forms
It is
of malignancies or
treatable,
cancer in men. And usually it's because of the way the prostate is set up.
Yeah.
If you neglect it is when you have a problem, because it would take a little bit for it to get outside to affect other areas. So you're being crazy. And I'm going to talk to you guys. You might be my brothers, you might be my friends, my
Oh,
colleagues.
yeah.
It's crazy to not go get screened, and when this is so treatable that once you get it early, you get treated early, you don't have any problem in terms of your much problems in terms of your life expectancy.
Yeah.
Because it's very treatable. So don't be foolish. Are you better off being afraid to go or dead?
Mm-hmm.
Go get the
Well,
screening.
I have 2 sons, and I encourage them. I said, look, don't be afraid. Some people say it's painful, whatever. The next, but don't be afraid. Go, because it's early detection, just like women and their breast, early detection.
I hate the mammogram, but I go every time.
You go.
But you know what? It all also goes back to the fact that most men do not want to go to the doctor at all.
That's the problem too.
And that's
That's
what
the
the real
problem.
problem is.
Yeah.
And so we have to do something. Women, you got to encourage your men to see doctors.
Is there like a rectal exam that involved them putting the finger
Yes.
there? And I think
that's
that's
where
what
the
a lot
pain
of men
is.
and I think a lot of men they associate that with, oh, is that really manly to let some man put their hand there?
Yeah.
Then get a female doctor if you're worried about that. That's what I say.
I mean, in Jamaica now, I don't know about the other islands, but I know Jamaica, they're having an epidemic.
Right.
Because most of the men in we call it districts, I don't know what you call it in your country, but the surrounding districts, they're up there and they're laborers or whatever. They never go to a doctor. So what happens now is that we have doctors here who, they have like missions, and they go down and try to go in the, little parts to help them to the hospital and all that. And it's happening as we speak. They're going there and trying. These men don't want to see a doctor. And then they grow these things that's called, whatever, I don't know, whatever, because of that, because you have a problem. But it's a very interesting subject, and I'm on top of it. I love to talk about it and read about it. Yes, because I have boys in my life, and I want to see them do the right things.
I'm actually thinking too, because I have boys, so
You have to have that conversation.
My husband is good at going to the doctor because of his condition. He goes to the doctor, and if his doctor say you have to do this, that, he will follow up and do what he has to do.
Yeah.
So he goes and get his prostate, and he does, all his physical and everything every year because of his kidney problem.
Yeah.
So that, and the kids see that happening.
So they're likely to follow him most
They
likely.
do, right. So, that's
You
what,
hope.
but still, exactly,
You hope.
they're home, so you know what they're doing, but when they're not around, when they're gone, when they go in, the next stage in life, do they keep that up? Would they,
They need to,
right
again,
now-
do you prefer to have your pride cause you to go to early grave. It's a very treatable cancer. So what's the worst case scenario if you do have it? Nobody's saying you like the idea of hearing, oh, you have cancer. But prostate cancer, I know so many guys that, some of them in the media, some of them from, like I get, not my immediate circle, but people that I know of or know. And they've had that diagnosed for years and they're still around. Okay? So, and there's so many treatments out there that does not necessarily render you, you know,
Right, incontinent.
incontinent.
Yeah,
I know I'm tripping over that word.
And basically, nobody has to die from
Impotent.
prostate
It
cancer.
doesn't necessarily make you impotent. I think that's what I was
And
looking
it
for.
doesn't
Incompetent,
necessarily
yeah.
do that either. I had my father had it. My several brothers. I mean, I think it's better to know than not to know. So 5 minutes of discomfort, it's okay. It's worth it if it means your life.
Yeah,
I agree. I agree. Wow. Okay. We're going to take a break, and when we come back, we're going to go with the Lady H. What do you have for us coming up?
we're going to be talking
a
about
special research.
caring for patients with dementia.
Dementia.
Okay,
Okay, so that's an interesting thing because a lot of us, we have an aging population. We have a lot of relatives and family members and just people you know. And I think Lady H, nobody does a research like she does, so I think she's going to be able to shed some light. All right, we'll be right back.
Visit Elias Restaurant, a unique Greek Caribbean fusion restaurant where the food is heavenly, the service divine, and the ambience mesmerizing. Enjoy bakes and saltfish, roti, jerk chicken, curry chicken, stew fish, oxtail, curry goat, stew turkey, pea soup, cowfoot soup, sorrel beer, ginger beer, Slovaki dinners, clubhouse sandwiches, and so much more. Visit Elias Restaurant, located at 3310 King Street in Toronto, Canada. You are watching QXTV, Cultural Experience Television. We will be right back.
Okay, welcome back to Caribbean House Talk, and our dear Lady H, who is going to do something for us in our special research. What say you, Lady H?
yes. Today we're going to talk a little bit about caring for a person with dementia. And, I might add, I'm going to be talking about the different aspects of dementia, just a little bit. Dementia is a progressive loss of mental function due to certain diseases that affect the brain. The losses are substantial. Over time, all types of dementia will lead to loss of memory, loss of reasoning and judgment, personality, and behavioral changes, physical decline, and death. But the course dementia takes can vary from person to person. It's influenced by many factors, including age and other conditions. A person may have 60 to 80% of US cases are caused by Alzheimer's disease. I learned that. I didn't know that.
So dementia is caused by Alzheimer's.
Alzheimer's. So
Okay.
most people have a little Alzheimer's. So we have different stages of dementia.
Mm-hmm.
In mild dementia, people may have difficulty remembering words and names, learning and remembering new information, and planning and managing complicated activities such as driving. They may also experience sadness, anxiety, loss of interest in pleasurable activities, and other symptoms of major depression. In moderate dementia, judgment, physical function, and sensory processing are typically affected. This can cause problems with personal hygiene, inappropriate language, and wandering. That's a big thing, wandering. This stage, when your loved one is able to get around but has poor judgment, is physically and emotionally challenging for the caregiver. As a patient moves from mild to moderate dementia, some home modifications that may include removal of throw rugs, installation of locks and safety latches, and the addition of a commode in the bedroom often needs to be done. This is also the time when the palliative care, that the team from the hospital or wherever can be brought in to support the caregiver and not manage and help to manage the behavior. All right. In severe dementia, there may be extensive memory loss, limited or no mobility, difficulty swallowing, and bowel and bladder control issues. There may be a need for round-the-clock care. The patient may have difficulty recognizing family members and caregivers. Caregivers experiencing high stress levels during the moderate and severe stages may also be dealing with anticipatory grief associated with a feeling of impending loss of their loved one. Talking with the palliative care teams, social worker can help caregivers understand these feelings and develop strategies for dealing with them. Experts warn that caregivers who do not get such help may be more likely to experience a prolonged, complicated period of grief after their loved ones dies. That's it in a nutshell. But
something very close to
it's very
my
close to
heart
home.
in
Yes.
that my great-grandmother had dementia, and my grandmother had dementia. And as my mother is getting to that stage with 80-something years of age, we're starting to watch her and have to be very careful with her. To look for the symptoms, look for, and it's so interesting because I had a conversation with my children where I told them, that probably will be me in another 20-something, 30 years. And, I just asked for them to be compassionate, me if it comes to that, but I clearly have a family history of it.
Yeah.
And if it does happen, I just ask them to be kind and do what you have to do to make your lives a little easier, but just be patient with me, because it does take a lot of patience. They're literally like reverted back to like kids. And, we have to remember when you have a loved one with dementia, these are the folks that took care of us. And so we have to be kind to them like they were kind to us when we were children. The human animal is the only animal that is born as a baby and takes about a year or more to walk. Other animals, they're born and within minutes they're standing up. So think about the patience that your parents took in raising you from that infant who's helpless. I mean, I often say, thank God babies are cute, because they're helpless and you got to do everything for them. And if they're not cute and you don't love them, it's going to be difficult. So your parents did all of that for you. And when they get down in age, we just have to be careful, be patient with them and be kind to them and recognize that it's not their fault. Sometimes they say things, they do things, it's difficult. Sometimes they leave their families entitled because they start saying things that are not true and the kids end up hating each other. You just got to recognize, don't hate them. It's just that that's the process that they go through. And
let me add also, my father, he had Alzheimer's, dementia, and it's very difficult. So if you are a caretaker, it is really important to seek help, support. Lady H mentioned the team that help you from the hospital, but there are support groups. I mean, when it happened to my dad and he passed away, this is now 19 years ago, so you didn't have as much help and support as you had then. My mom was sick, but she did everything that she could, and we kind of chipped in, but it's hard. It's very hard on the caretaker. Patience is, it's easy to say have patience, but it's difficult to really do. And when you're watching someone that you love kind of resort back to being like a baby, it's very hard. We're used to seeing our parents as these strong people who raised us, and when all of a sudden they're not strong anymore, and they're like a baby and you have to take care of them, it's really difficult. So I tell any caretaker to
Get help.
talk to support.
Get support.
And get help.
I'd like to add.
Stop trying to do it all. Get somebody to come in and relieve you 5 hours a day.
Absolutely.
Do something because you're gonna need some time for yourself. I have a friend that this person doesn't have dementia, but have a sick spouse, and it's so frustrating for her. And I keep saying to her, you gotta get some help, save you a little bit. He is ill, he needs you, and you're running yourself into the drain. So the same thing with dementia. If you have loved ones with dementia, hire somebody, even if it's for 2 days a week for 4 or 5 hours, where you can go out, get a cup of coffee, meet with friends, go have your nails done, go have your hair done, do something. Get support because you need support as well.
Well, it hits home for me. My mother had dementia, but she didn't develop dementia until she got into the nursing home. And when I saw how they were treating her, I went out and took the course in how to. It took me 3 months, but I did the course. And that sort of saved me that feeling of loss and whatever. When she started having dementia, she would get in the wheelchair and go to the elevator. She wanted to go kill herself. That was the main feature there. I didn't know how to deal with that, and neither did the hospital, the nursing home. So I had to, and I spent a lot of time there with her. But you have to be very patient, very kind-hearted. You have to know, when to and all that. A lot of the people at the nursing home don't know how to deal with it because they're not trained that way, So it's very hard.
But also too, they're also kind of dealing with multiple people, and it's not personal to them. So, and being fair to them, having had both my parents go to nursing homes, we get upset. But the people in the nursing home. Again, this is not their family member, and they have to kind of be
professional.
They have to be a professional. They can't feel like we feel.
Yeah.
And it's good that you guys touch on the nursing home aspect, because I know Caribbean people, there's almost a taboo with putting your loved one in a nursing home.
Yeah.
I don't mind my children putting me in a nursing home if that's where I would get the better care, because my kids are going to be walking, they have their own families. But just check on me, just make sure people are doing like what you did. You went and you saw that they weren't treating mom what you like. You did a course to make sure that you're able to, assist in whatever way you can in terms of supporting her better. But we as Caribbean people want to do it all. We don't want to put our love in the nursing home. I would say yes. I would hope that they'll get a little room for me and let me stay home. But I'm not opposed to a nursing home if that's where it is best.
And that's a thing. It's not Caribbean. That's a thing with Black people.
Black people, yes.
We feel it's taboo. You can't put a family member in a nursing home. They're supposed to be home. You're supposed to take care of them. And I agree. But there comes a point sometimes where you cannot. And when you cannot...
And they're walking away and you might not be able to be there all the time, yeah?
But then I say one little thing. You said something about you spoke with your kids and you might get it. But you don't have to get it.
No, I don't have to. I may.
Because I work with my doctor now and I talk about it a lot. Because I know I could be there. But he said, you know what? That's the problem with us. We feel that because our forefathers had this, we have to have, there are preventive methods. And he works with me, he says, well, you have to have your green leafy vegetables and take it more seriously. You have to have you do your trivia. You have to keep the mind alert. You have to do, so you have to help yourself. Don't look at it.
Oh no, it's not your parents have it or grandparents. You're going to have it. There is a potential, and you have to be proactive, and you also have to prepare yourself if it does come down to that. Because there's a potential. You can't ignore it like it could never happen to me. And when you have a family history, but it doesn't have to happen to you.
It doesn't have to. The technology now, you never know. 20 years down the road, they might find a cure for certain things, and that might be one of the diseases. So I have a positive feeling about it.
Okay.
And I'm not going to have it. I'm not claiming it.
Okay.
I never had to deal with it, so I'm listening. I'm really...
Okay.
This is all new to me because when my mother was in her 90s, but she's passed now, she was blind, so most of her time she would spend just sitting there, and she would just, if you call her, she's gonna say, oh, I'm seeing this and I dreamed that, and for her it was, and I think she was really in the zone. She knew what was going on around her. And I would not say that she was at the point where she didn't know anything, but she knew what was happening.
Mhm.
And she would tell me, and she would say, oh, don't tell this person that I tell you that, stuff like that. But at the same time, I don't think it was that far off left field to say that she was that bad.
Mhm.
But, in a nutshell, I didn't have to deal with that.
Mhm.
So much I don't know about.
Yeah, like I say, I've known not just my grandmother and her mother, but a lot of like people. My mother's twin sister had it. One of her brother had it, but there were people in that family that didn't have it. The two twins that have it, my grandmother had three sets of twins. Two survived. So one brother had it, the other one didn't have it. And the two girls that are twins, one had it, the other one didn't have it. So it's not a definite, but you do have to acknowledge when you see it running in families. And hopefully by doing that, you'll say, I don't want to get this, so let me eat them leafy vegetables, let me do this, let me do that. So this brings us to our next step. We're going to go down into our health and fitness section. We normally do that during the day health team segment, right after the day health team segment. We didn't do that today, we deviated a little bit. So, because we wanted to talk about, the prostate issue, and then we're going to talk about the dementia issue. So now we're going to talk about some health, not about these two issues, but some health food benefits of tamarinds. So we're going to take a break, and when we come back, we'll talk about the benefits of tamarinds, and we're going to do a little news segment, and then we'll wrap it up for this segment. Okay, so stay with us. We have a lot more show coming your way. Thank you.
Visit Elias Restaurant, a unique Greek Caribbean fusion restaurant where the food is heavenly, the service divine, and the ambience mesmerizing. Enjoy bakes and saltfish, roti, jerk chicken, curry chicken, stew fish, oxtail, curry goat, stew turkey, pea soup, cowfoot soup, sorrel beer, ginger beer, Slovaki dinners, clubhouse sandwiches, and so much more. Visit Elias Restaurant, located at 3310 King Street in Toronto, Canada. You are watching QXTV, Cultural Experience Television. We will be right back.
Okay, welcome back to Caribbean House Talk. And we're going to come to we did things a little bit out of sort today. We're going to come to our health tip area of the show. We normally do that after the health team, but today we kind of switched a little bit because we were caught up in talking about dementia and prostate cancer and so forth. So we're going to talk about tamarinds or tamarind. And you're from St. Vincent Island of Jamaica. They say tamarinds, and you're from the island of Antigua. Okay, let me introduce you. This is my brother Augustine, nicknamed Logie. All right, my younger brother, he lives in the island of Antigua. He's married to an Antiguan and I have beautiful children. He's visiting, and we decided to have him on the show. He was supposed to make it to an earlier segment, but he got stuck in a little traffic delay there, so he wasn't able to make it. So he's joining us later on the show. So, welcome. Okay. So anyway, what I want to do today is to discuss tamarinds. Okay, I want to discuss the benefits of tamarinds or tamarind. The ones that we have on the table, I want you to just pick up this with the camera. It has a hard shell and it has a pulp inside with some seeds. Okay, so this is what we're talking about, tamarinds. Okay, and when tamarinds, I grew up eating on this stuff, and we really have the real serious one in the Caribbean, in that it's really sour. But some of them could be kind of Swedish, but the ones that they bring from Taiwan, which these are, you see them in the supermarket, it says, has sour tamarinds, which is similar to what we have home, and it has sweet tamarinds. And this one is a more medium sweet one. But I never realized it had these benefits, and I'll tell you a little story about what happened to me. Some of the benefits of tamarinds, I have 10 here, but I can list some others, and I'm sure Lady H, you can list some as well. Anti-inflammatory properties. It has great anti-inflammatory properties. It promotes digestion. It's very good for constipation. It boosts the immune system. It keeps the heart healthy. It keeps the skin healthy. It aids peptic ulcers. It promotes weight loss. It controls diabetes. It improves nerve function. And I personally can attest to the fact that it's very good for dry eyes. I had a bad case of dry eyes. I would get up, especially in the summertime, and my eyes would feel almost like this crust under them. It's real, and like it's abrasive, like your eyelids are so abrasive against your eye. There's not enough fluids there. My sister was visiting me, and I started eating the tamarins. It was like, I don't know how my attention got caught to it, but we would use them and go into my son's room at nights, and we'll just have it as a snack. Well, all of a sudden, I just kind of never noticed that I no longer had dry eyes until I saw something flash up online. Tamarins, great for dry eyes. And I said, oh, that's why I no longer have dry eyes. So that's how I accidentally found out that. So this is a wonderful, wonderful food. Now I'm gonna have everybody try one. Just take one pop.
I got a question though.
Mhm.
So you said in the islands you had the sour and there's sweet and there's mild sweet.
In the island, we just have the
benefits
sour.
matter? Whether it's sweet, sour, or
No, just it doesn't have as much acid, I think. I don't know.
In Jamaica, the sour ones, we pour water on it and put it in the refrigerator and sort of crush it, get all the flesh off it and drink it.
Yeah, that's very prevalent.
And
Yeah,
we
there's
drink
a
it
drink,
like a
yeah.
medicine. And some people put baking soda in it if you have a cold, and it helps you, So it really is a good product.
And tamarind balls.
Tamarind
We take
ball-
the pulp.
If you go to Key Food here in New York,
Mhm.
over in Valley Stream, they have a little place where they put tamarind balls. And if you don't buy, like you buy a pack,
Mhm.
it's delicious. You go back, it's gone. The Jamaicans know when to go there to get these tamarind balls. So it's a good product. And for me, I have a box on my bedside, and I eat 2 tamarins every night in order to go to the bathroom.
there's seeds in it that you're.
I
You can take the seed out.
Yeah,
I use my teeth
but it's
to
a
take the
very
pulp
good
off of the
product.
teeth, out of the
Very,
teeth.
very good for your digestive system.
Mhm.
And
And so I spit the seeds out.
yeah,
I'm using my teeth
So you
to
just
remove.
eat it and take the seeds out.
I'm taking my teeth and
Never had
pull the pulp
No,
off.
never had.
Never had it?
Sorry, don't laugh at me. Sorry.
you get the
Really good stuff.
As I was saying, in Antigua, it's a local drink. So if you go to a restaurant, especially a local restaurant, they'll give you that option what you want. Passion fruit or tamarind, stuff like that. So it's used similarly to what our guest is saying they use in Jamaica.
Yeah.
It's very similar, but it's just like a drink.
yeah.
Okay. Well, tamarins. That's I live by them. I love them. I go to my supermarket and I get them. And I love when I see tamarind bars being sold, like in some of the green grocers. I pick them up. When I go to St. Vincent, I make sure I go pick them up from the vendors and bring them back, give some to my staff. Really good food.
Not bad.
So you can make. You just said that the fruit, the seeds, the bark, the leaves, the blossoms, they're all good. You can make candies with them. You can make jam. Well, the candies I think would be the tamarind balls that we got. Sauce. You could eat them raw. You could make a drink. In Asia, they put them in their food. They cook it in their food. So it's really, really, really good. So recommend it. Again, we're not medical doctors. We're not asking you to forego your doctor's advice or use these things for treatments of illnesses without checking with your doctor or just using your common sense. I think for me, I try to do a lot of this stuff while I'm still a relatively healthy person so that hopefully it could help me. But I wouldn't say if I have a serious condition of any type that I'm going to go use this to take care of it or just do it and not follow my doctor's advice. I definitely do not recommend that. So we're going to delve now into our politics side, but I have to say now, you're false. I don't think we've ever had a male on here before. We always say that we need a male perspective on stuff. So, that's interesting. that we have you as our first guest. So you can consider yourself a first at QXTV, Caribbean House Talk, not the network, but the show. Let's talk about politics a little bit. I'm going to put this down until later. Because you got to use your teeth to kind of get that pulp off the seed. So I'll feast on that later. I want to know what everybody's thinking in terms of our president. I still cringe when I say that, but our president, who has now appointed, he fired the Attorney General, who recused himself from the Mueller special investigation because he felt he shouldn't have recused himself. He has put in place someone who many say are not suited for that job or qualified for that job. But more importantly, whether he's qualified or not, people are saying, this is a conflict of interest. This guy is one who's made it known that, actually suggests ways to stop after the special counsel investigation, which could end up with the president being impeached if they find something. How do you find a guy who say, I'm recusing myself, I'm not getting involved, but I'm going to hire one that says, let me tell you how to kill this investigation, and put him as acting, when the other people, like the Deputy Attorney General, was more suitable for that job by most assumptions, that he would be the most suitable person. Is that not a clear case of interfering?
Okay. Well, I it's a little awkward for me in the sense that I am not living here per se, but let me say this.
So you have lived there in the past.
But the world all over, in Antigua, we see the very news you see, and we're looking and we're hearing and we are forming our own opinions. Because you don't have to live in America to know something is right or wrong. And I think it's clear when you're dealing with positions such as Attorney General, and even from our standards and internationally, you want to have somebody who is non-partial, right? That's why I believe the former Attorney General recused himself, because he wanted to give the clear assurance of his non-partiality, which is the right position, right? But apparently, by him doing that, got him in some trouble with someone who's seemingly trying to
Obstruct.
And so you see a situation where he's now willing to put somebody who, from even your statement and what we're seeing on the news, seem to have an agenda to protect the president.
But he may be surprised because this guy is going to realize that if this guy goes down, I could end up in a mess, and that's not worth it. So maybe he said what he had to say to get that position, but is he really going to put himself on the line? We see what happened with Cohen. Or I'll take a bullet for him, and he was there trying to rough somebody, threaten somebody at one point, but when it came to the point where the feds were going after him, he sang like a canary. Just this week he was in court, singing like a canary, So what may very well happen is this guy might have said what he needed to say to get him to put him in that spot. And he might have even been thinking about it, but he recognized there's going to probably be some jail or something wrong here if this guy get impeached and if he's seen as interfering. So it may not work the way he said, but I think in my opinion, this is my opinion, I feel it's obstruction. There's no way you should fire someone and put somebody that you think is going to give you the outcome that you need or want. I don't think that doesn't make sense to me.
The thing is, it's like, how does... I'm still amazed at how the president gets away with certain things, that he can just do. I know an appointee you can appoint, but he's getting away with a lot of stuff, and I don't understand it. It's like, I don't know.
It's the people behind him.
Well, you did say he has his house and the Senate, so he has his base.
Yep.
I mean, we have to wait and see what will happen.
Well, you won't have the House coming up on January.
Right, so we're going to, that's why I say we wait and we see what happens. Because Mueller, if you notice, he doesn't take any, outside assignments and and give speeches and all.
No,
that.
he has been
He's
very professional.
focused on what he's doing.
Mhm.
Right now, as we speak, the man is preparing his report because he's winding down.
Right.
So I just create patience and wait.
It's a hard thing to
Because
watch. Though.
it's hard to watch, but it's interesting to me. I'm learning politics. So I find it very interesting. Every day you come up with something. 45 is asking if he's going to be the Nobel Prize winner. That's his interest. To me, his interest should be.
What am I going to be impeached?
So I'm waiting to see.
The issue with Mueller for me is, as a person with investigative background,
Yeah,
he is the apex of a professional investigator
I mean,
because he doesn't reveal his hand.
yeah.
And let me say this: if the president is going to be impeached, Mueller already has the evidence.
I think so.
I believe whatever it is, he has the evidence. All he's doing, if you look at his pattern, he's doing. That's how an investigation
Yeah.
function. You do the background investigation around what you have, so that when you tie that in, you have all the evidence back in. If he goes straight to what he has, perhaps the president or his team can get to the persons knowing what he has and then stall it. But when you already got persons to speak and give you evidence to support what you have, by the time the person being charged or impeached in this case try to get to them, we already have a statement. And so that is where I see Mueller is operating from that level where he has the facts, he's now doing the background around it, and once he does that, he will have, it will be difficult to me for them. I know there's some administrative issues that may still have some effect, but I don't know the intricacies of how that works. But in terms of from an investigative perspective, I think Mueller is doing it the right way.
At what
I
point?
think he's doing a fantastic job. But you see what the president is putting out there that, for instance, Manafort, that a pardon is not off the table. That again is obstruction. You're telling
Yes,
him,
it is.
lie for me, they'll jail you, but I'll pardon you.
I'm gonna pardon you.
How does this man, you asked it,
Get away
how
with
does he get
this?
away?
Oh my
If
God.
Obama did half a quarter of what he's done, they would find a way to go in the
16th.
White House and get him.
116.
The 16th. I'm telling you, I don't get how he's getting away with this stuff.
But the problem is he's doing it in broad daylight. And for some reason, it's as if we're still acting as if the world is acting as if you still need to go and find something. He's doing it right before you.
In your face, he's telling you, he's letting everybody know I'm obstructing justice
Right.
here.
You don't
What are
need
you gonna do about
yeah.
it?
At what point do you impeach a president? I mean, at what point can they impeach 45? I call him 45. But at what point can you do that?
Well-
Is it in office? Is it?
Well, remember they're doing things with the Russia probe to
Yeah.
see if he was doing a lot of illegal stuff there. Even though there might be things regarding his taxes, which we still haven't seen those tax
Right,
documents.
right.
Which I never thought I'd see America elect somebody who refused to give his tax documents, and you didn't stop to think something was funny there. You still went out and overwhelmingly got him in there. So
But
there's a lot of
that
stuff
is
that's been
because it
investigated. He hasn't been found guilty yet, but
Trish, the tax thing, it wasn't a part of the law. Like you had to do it.
right,
Yeah.
People,
right.
the other past
A precedent
presidents and
was
all,
set.
right? They set that precedence to do
Yeah.
it, but it wasn't a law. So
Right,
that's
but
why
it has
we
become a custom. And why would you
Yeah.
not think he is too shady? No. Why would he, if you have nothing to hide, you hide nothing. It was not part of the law, you're correct. But you should have, I feel like the American public should have sent a message and say, if you're acting secretive about this stuff,
Something is
Something
wrong.
is wrong. I'm not voting.
What else are you hiding?
Exactly.
Yeah, sure.
You know? So,
I agree.
a lot of this stuff. I'm sure for the whole season we're going to be talking about different political stuff. But I just want to take a minute to kind of thank our viewers. We want to say a shout out to Peru, to Colombia, to Brazil, to the Philippines, to St. Vincent and the Grenadines, St. Lucia, Grenada, Jamaica, Ghana and Sierra Leone. We have a lot of followers there. Thank you very much. Great Britain, Canada, the United States, and I could keep going on and on. We have a lot of viewers around the world, and this is a beautiful thing and a powerful thing about online television. You have internet access. You can see QXTV by going to YouTube and look for QXTV, which it might sound as if I'm saying Q and an X, but it's actually CUEX TV. So you can go there, you can go to our website, qxtv.com. You can also follow us on our Binge Wave channel, which we use a lot of feed to social media. And in terms of, not just in terms of Caribbean House Talk, but we have so many other shows. We have Fashion Melee, we have Are We Bacchanal, we have Soulful Scrutiny, we have Cultural Classroom, we have Cultural Heartbeat Films, Caribbean News Blast, The Writer's Nest, and I know I'm missing some there, but go to our YouTube channel and you will see our Binge Wave channel, and you'll see a lot of our shows on there. You can follow us on our Facebook page. We have a Facebook page that you can follow us and get all the updates for things that we're posting. And we look forward to a vibrant season 4 in the Caribbean House Talk. But we promise you to continue to bring you not just things from Caribbean House Talk, but from all of our other shows. I'm going to be doing actually a Facebook Live once or twice a month. And with that Facebook Live, we're going to be asking questions. So it is in your benefit as our viewers to start watching our network shows, so that when we bring a question and we're on the live, the person who answers first gets a gift. I'm not going to tell you what that gift is going to be, but it's going to be worth your while. All right, so follow us, continue to watch us. We appreciate it. We don't take you for granted. And I thank you for joining us in this edition of Caribbean House Talk. And we'll see you on the next episode. Bye-bye.
Bye-bye.